Most people do not feel retirement pressure all at once. They feel it in small moments, a bill that is a little higher than expected, a prescription refill that costs more than it used to, a grocery receipt that makes them pause for a second before folding it and putting it away. And after 60, one of the quietest shocks is healthcare. Not because people thought healthcare would be free. Most people know better than that. But many Americans spend years believing that once they reach Medicare, at least one major problem will finally become easier. After decades of premiums, employer plans, deductibles, paperwork, and worrying, Medicare can feel like the finish line. But for many households, it is not the finish line. It is the beginning of a different kind of calculation. You may still have a mortgage, or a car payment, or credit card balances that were supposed to be temporary. You may still be helping adult children, supporting an aging parent, or trying to make one retirement account stretch further than it was ever meant to stretch. The electric bill still comes, property taxes still come, insurance renewals still come, and then, sitting quietly beside all of it, healthcare becomes another monthly bill. That is the part many people are not prepared for. Medicare helps millions of Americans. It is a foundation, but it is not a magic shield. And the mistake many households make is not laziness, or carelessness, or living beyond their means. The mistake is assuming that one word, Medicare, means the healthcare cost problem has mostly been handled. But the real problem is not one bill, it is the layering. There is the Medicare Part B premium. In 2026, the standard Part B premium is $200.90 per month, with a deductible of $283. On paper, that number may not sound shocking. But real life does not happen on paper. Real life happens at the kitchen table, when that premium sits beside groceries, utilities, home insurance, car insurance, prescriptions, and the credit card bill that keeps carrying over. Then there is the Medicare Part A hospital deductible, which is $1,736 in 2026. Under original Medicare, many Part B services can also involve 20% co-insurance after the deductible. And depending on the household, there may be prescription drug coverage, supplemental coverage, co-pays, dental bills, vision expenses, hearing costs, and specialist visits that do not feel dramatic by themselves, but become heavy when they arrive together. That is how money disappears in retirement, not always in one crisis. Sometimes it leaves quietly, through small deductions, small medical charges, small gaps, and small surprises that nobody talks about until the budget starts to feel tight. KFF reported that Medicare beneficiaries spent an average of $6,459 out of pocket on healthcare in 2023. The same analysis noted that average Social Security income among Medicare beneficiaries was $17,718. When those two numbers are placed next to each other, the picture changes. Healthcare is not just a medical issue, it is a retirement income issue. For someone living on a fixed income, every recurring cost has weight. A prescription refill is not just a prescription refill, it is money that cannot go toward groceries. A dental bill is not just a dental bill, it may become a credit card balance. A specialist copay is not just a copay, it is another reminder that aging has a price, and that price often arrives at the same time income becomes less flexible. This is where many middle-class households begin to feel something they rarely say out loud. They are not poor, but they are not protected. They may own a home, but still feel squeezed. They may have savings, but not enough to feel safe. They may look stable from the outside, while inside the house, every bill is being weighed against the next one. The trap is not always poverty. Sometimes, the trap is appearing comfortable. And healthcare makes that trap harder to see because it feels legitimate. Nobody thinks they are wasting money by seeing a doctor. Nobody feels irresponsible for filling a prescription. Nobody plans to need hospital care, dental work, or help at home. These are not careless expenses, they are human expenses. That is what makes them so dangerous to a retirement budget. Fidelity estimated that a 65-year-old retiring in 2025 may spend $172,500 on healthcare and medical expenses in retirement. For a 65-year-old couple, the estimate was about $345,000. EBRI estimated that a man may need $212,000 and a woman may need $252,000 for a 90% chance of covering Medicare-related health expenses in retirement. For a couple with average Medigap premiums, EBRI estimated the figure could be $405,000. Those numbers are not meant to create panic, they are meant to show scale. Because many people enter their 60s thinking about retirement as a question of income. How much will Social Security pay? How much is in the 401k? How long can the savings last? But healthcare turns retirement into a second question. How much of that income will be claimed before you even get to ordinary life? And ordinary life is already expensive. A retiree may open a Social Security notice and feel relief for a moment. Then they look at the deductions, they look at the premium, they look at the prescription plan, they look at the dental appointment they have been putting off. They look at the grocery receipt, and slowly, the feeling changes. This is not the retirement they imagined. For some households, the biggest shock is still waiting further down the road. It is not a monthly premium or a prescription, it is care. Long-term care is one of the most misunderstood costs in later life. Many families assume that if someone becomes frail, needs help at home, or can no longer safely manage daily routines, Medicare will step in and cover the need. But many forms of custodial care and long-term support can become a separate financial burden. CareScout reported a national median cost of $35 per hour for non-medical caregiver services in 2025. At 44 hours per week for 52 weeks, that equals $80,080 per year. Assisted living national median cost was reported at $70,800 per year in the 2024 CareScout and Genworth survey. For a comfortable household, those numbers are serious. For a fixed-income household, they can feel impossible, and these costs do not usually arrive politely, with years of warning. They often arrive after a fall, after a hospital stay, after memory problems, after a spouse becomes exhausted, after adult children realize that mom or dad needs more help than anyone wanted to admit. That is when health care becomes more than a personal expense. It becomes a family conversation, sometimes a painful one. An adult child starts covering groceries. A spouse cuts back on work. Savings are drawn down faster than expected. A credit card becomes the bridge between this month and next month. And what began as a temporary solution quietly becomes part of the household's financial structure. This is how control is lost without a single obvious mistake. Imagine a couple in their mid-60s. One spouse has started Medicare, but the other is not yet 65. They expected this stage of life to feel lighter. Instead, they are balancing one person's Medicare costs with another person's pre-Medicare insurance situation. The house needs repairs, the car still has a balance. Grocery costs are still uncomfortable. They did not make some dramatic financial error. They simply reached retirement with less room than they thought they had. Or imagine a 71-year-old widow who owns her home and lives mostly on Social Security and a small pension. Her medical costs are not catastrophic in any single month. That is why the problem hides so well. A premium here, a prescription there, a specialist visit, a dental bill. Then a credit card charge that was supposed to be paid off quickly, but the next month brings another charge, and the month after that brings another. Or imagine a 60-year-old man who plans to retire at 62. He has worked for decades. He is tired. He believes he is close. Then an aging parent needs help at home, and he sees what care actually costs. Suddenly, retirement is no longer just about replacing a paycheck. It is about preparing for a stage of life that may require money, time, patience, and family decisions nobody feels ready to make. These examples are fictional, but the pressure behind them is real. The fear is not just running out of money. It is losing dignity. It is becoming dependent. It is having to ask children for help when you spent your life trying not to burden them. It is watching a lifetime of work become vulnerable to costs you thought would be covered. That kind of fear is quiet. Many people do not talk about it. They smile at family gatherings. They say they are doing fine. They keep the bills in a drawer. They delay the appointment, postpone the dental work, stretch the refill, or carry the balance a little longer. Not because they are careless, because they are trying to stay stable. And that may be the most human part of this story. Many Americans after 60 are trying to get rich. They are not trying to beat the market. They are not chasing luxury. They are trying to avoid slipping backward after a lifetime of effort. They are trying to keep the house, keep the car running, keep the lights on, keep the credit score from falling, keep their health under control, keep their children from worrying, keep their pride intact. Healthcare sits right in the middle of all of that. This is why the hidden healthcare shock matters. It is not only about Medicare premiums or deductibles. It is about the emotional collision between aging and money. It is about discovering that one of the most basic needs in life can become one of the most unpredictable costs in retirement. And the warning is not that every household will face the same outcome. They will not. Health is different. Family support is different. Savings are different. Coverage is different. But the pattern is common enough to take seriously. A household that looks prepared can still be exposed if healthcare costs were treated as a side category instead of a central part of retirement. That is the quiet shift many people need to see. Healthcare after 60 is not separate from the retirement plan. It is part of the retirement plan. It belongs beside housing, food, transportation, taxes, insurance, and debt. For many Americans, it may become one of the largest and most persistent claims on later life income. Seeing that clearly does not solve everything, but it can remove the shame. It can make the pressure feel less mysterious. It can help explain why a person who worked hard, saved some money, and did many things right can still feel financially uneasy, because sometimes the problem is not one bad decision. Sometimes the problem is a system of costs that keeps expanding while income becomes more fixed. And that is why the phrase, "I'm on Medicare now," can be both comforting and incomplete. Medicare matters, it helps, it protects, but it does not erase every bill that comes with aging. And if a household believes it does, the shock can feel personal when it finally arrives, as if they failed to understand something everyone else knew. But many people did not know, or they knew in pieces. They knew there would be some costs, but not how many. They knew healthcare could be expensive, but not how it would feel on a fixed income. They knew aging would bring changes, but not how quickly those changes could reach the family budget. So, perhaps the real lesson is not fear, it is attention. Attention to the small bills before they become invisible. Attention to the assumptions people carry into retirement. Attention to the difference between being covered and being fully protected. Attention to the quiet ways money leaves the household, not because someone was foolish, but because life became more expensive at the exact moment flexibility began to disappear. After 60, the question is not only whether there is enough income to retire. It is whether that income can survive the costs people rarely discuss until they are already here. The medical bill, the premium, the dental work, the prescription, the home care conversation, the adult child who wants to help but has bills of their own, the savings account that was supposed to be for peace of mind, slowly becoming the account that catches everything else. That is the hidden healthcare cost shock. And for many Americans, seeing it clearly may not make the road easy, but it can make the road less confusing, less lonely, less filled with shame. Because if you have felt this pressure, it does not mean you failed. It may simply mean you are seeing what many households eventually discover. Aging in America has a financial side that is much deeper than the monthly premium. and the sooner that truth is seen, the less power it has to surprise you in silence.